Okay, so if you are ready and comfortable, we could move on to
Sure, sure.
topic 2.
Yeah.
I would like to invite again Datin Mariani Ahmad Nizaruddin to present her topic on prioritization of community pharmacists in the National Immunization Program.
Thank you. Thank you, Dr. Madhu. And I hope to share more of the answers after we have touched on this session. One of the areas that we covered in the earlier session was to talk about how pharmacists have actually been doing a lot of things but not being recognized for it. So one of the aspects that happened over the 2 years of COVID in Malaysia was to uplift the role of the community pharmacist and recognize as an essential frontliner. And also the pharmacist private sector, they have to be highlighted here. So the prioritization of the pharmacists, next slide. Basically, let's talk to what Dr. Madhu has just discussed. Actually, it's very important that we start on the same page to say that I have always felt that community pharmacists are primary primary care team members. And this is mostly because in countries like United Kingdom and Australia, there is always a primary healthcare team which comprises the doctor, pharmacist, nurse, and patient, of course, the team members. So in Malaysia, because of our unique system, as you know, our system is dichotomous, meaning we have public and private care, but our system is also largely doctor dominated, okay? So what happens is that sometimes you have heard pharmacists not really fully recognized for their professional roles because they are in a community pharmacy setting. They are sometimes identified as a seller of medicine, but actually we ourselves are very much advocating. Every time we meet customers, we ourselves are the ones that can say that we are professional and providing essential service as a community pharmacist. And the primary care level, where you see the government clinics, a lot of the government clinics, clinic kesihatan, and the pharmacists based in the clinic, I would always associate our colleagues in the government sector to be also our community primary care staff, because they are always seeing the first-hand patients, before they, like Dr. Madhu said, before they go on to the secondary care in hospitals. So this is what links us up. We are primary care workers, primary healthcare team members. And it's important to identify this and include the private sector in this as well. So what I was sharing just now, this slide helps us to understand a little bit about how the vaccination rollout is going to happen for community pharmacists. I just want to share with you that at every community pharmacy level, private community, you need to have a license A registered with the State Health Department. So that is how the information has been fed to the MPS registration, and how that information has been passed on to the pharmacy services program. And that is how they're going to contact the pharmacists that have actually registered for the vaccination. Okay, so next slide. The important thing to address here, of course, of our priority is that we have to talk again about this red box that exists. There's a red box that exists in our system where we are not, along with the general practitioners, are left to sort of our own devices, a free for all system. So the GPs and pharmacists sometimes are seen to be competing. But again, if we want to prioritize our role in the healthcare system, we need to also provide a very identified role. So I feel that our role should not be to compete with GPs, but we complement one another. So this is going to take a lot of how would I put it? A lot of work, because more and more of the public is beginning to understand what a community pharmacist does. But I think we should keep doing what we do best, and maybe not encroaching on and not taking all the rest. Yeah. So next slide. So just to share with you, okay, because this brings a bit more understanding to how we are going to prioritize pharmacists in the system by recognizing our roles as well, is that a lot of things that we need to do now to prioritize community pharmacists in COVID-19 vaccination and so on, is to also recognize the roles of the expanding roles of community pharmacists. So we have tried to do quite a few things under community pharmacy chapter. Okay, I just want to share with you that we have submitted, for the benefit of all, pharmacists as well as undergraduate students. Navigating community pharmacy in Malaysia is not easy, because you have actually got independent pharmacies, you have got community chain pharmacies, as well as franchise systems. So it is not very unified. It's not very unified, but we have identified that the independent pharmacies, the mom and pop shops, are very important to sustain. So one of the things that we try to do in MPS is to ensure continuing education. Yeah, because all services that we want to start to deliver have to be based on our training. Yeah, and our training, all of us left university at different times. Some left 20 years ago, some left 10 years ago. So I would say the skills of the young graduates that have recently graduated, their skills may be different from those who have graduated 20 years ago. So that's, for example, in my time, it was not common to learn about devices like the insulin pen. But today, because of the big health crisis or that diabetes poses to Malaysians, I think we should start doing all these educator roles even in these diseases. So this is just to share with you what is community pharmacy doing at the moment. We're doing so many things like working on medication review, we're looking into geriatric care and so on. So this is the general picture, so that we can show to the government and we can show to the higher authorities of the potential roles that we can play, and therefore how can we be prioritized in the system. Yeah, next slide. So before that, before we were able to even ask for prioritization in the national vaccination program, we wanted to make sure that our pharmacists are ready to be vaccinated. There wouldn't be a very good case if we were to insist that pharmacists be vaccinated in the program, but we didn't have the buy-in from pharmacists themselves. So as you can see, a lot of studies have been produced, very recent. This is in about 2017, I'm not mistaken, by the University of UCSI, to look into how do pharmacists perceive vaccination, and it's pretty encouraging. It's pretty encouraging that pharmacists are very open to it. Next slide. And also our own survey that was conducted just in March to try to get the buy-in from the pharmacists before we ask for vaccination from the government, was to find out how many pharmacists want to be vaccinated. And we had an overwhelming 89%. Okay, this was from the community sector, the private sector. So we needed this data to help us prove our case, to go forward into the JKJAV, that was the Planning Task Force for Vaccination program. Thank you. Next phase. So with this good data that was thankfully in favor, to show that community pharmacists were ready to be vaccinated together with private hospital pharmacists, we began to write letters to all the relevant bodies. Next slide. Okay. And the reason we did this, the reason that we needed to show that pharmacists were ready to be vaccinated themselves was basically that we know those who are vaccinated propagate the positive aspects of getting vaccinated. It's like if you have done it, I think you will be able to pass on the message for others to do it. So that was our real argument to the Ministry of Health and to the authorities, that as essential healthcare workers, we come across a lot of patients, a lot of customers and the public who come to see community pharmacists for minor ailment solutions, for advice on medicines, for helping them for medicine review. So therefore, we need to be protected ourselves for the public to come and access us. So we would like for them to consider us as they consider the general practitioners, that we need to be protected too. Okay, next slide. And so these are our counterparts. There is Associate Prof. Dr. Haniki, who by virtue of running the International Islamic University Malaysia Hospital Clinic, or he does a lot of smoking cessation, he was in first phase, even though academia, some of us in academia will get the vaccine later only, but he was in first phase, and it's a good message because he was one of the early pharmacists in the sector, yeah, besides the Ministry of Health. And on the left is our friend in Labuan, who was very active in many, many proposals. So government pharmacists were being vaccinated. Next slide. And I just want to share with you that in the beginning, you know, a year ago, even to get the pharmacists recognized as frontliners was an uphill battle. So a group of us from the MPS went to visit the authorities, like actually we went to visit the ROC, because the ROC wanted to understand better what is the entire nature of the community pharmacy business. And this is where we have to explain that as of 2019, any entity that is incorporated as a pharmacy business has to have a director as a pharmacist. So this is a very positive thing for pharmacy, because if we do not protect our own practice of how community pharmacy, how wholesaling is conducted, then we are at a disadvantage for the development of pharmacy. So one of the ways to advocate for this was to recognize that pharmacists could go every day during the MCO to open up their pharmacies. Okay, and this, even some pharmacists, they found that they sometimes had to explain to the police or the roadblock inspectors there that they had to go to open up their pharmacy for the day. They were essential. So all this was very good data to argue our case as to why pharmacists should be prioritized in the National Healthcare Vaccination Program. Yeah, next slide. So these are so many articles that have come out as a result of letters and conversations and seminars, so many things that we want to be included, because we are essential healthcare workers and we treat the public, and we also may be at risk, therefore we should be protected. Okay. All right, and as you can see, we have had a lot of support from media, and this is a continuous war on media perception. I would like to just share with you all, especially the very young IT savvy, that your social media is a strong force to do good. If you do good, for example, you may want to propagate the messages that we share on the websites, on the internet sites. You might want to share with members of your family and your public as to the benefits of being vaccinated. But you yourself also always bear in mind that a lot of these things are still, we're still facing an uphill task to get recognition fully. Yeah. Okay, next slide. So happy to report that after some very strong work by Mr. Amrahi and Ms. Harpreet and Dr. Hafsan and Prof. Haniki, you know, Malaysian pharmacists were rejoicing, because now it been informed that community pharmacists will be included in phase 1, but category 2. So not phase 2, but phase 1, category 2. Today I heard there's still some issues about the vaccine availability, but pray that we are the pharmacists are in the list, and the Pusat Kesihatan Daerah is keeping in touch with those pharmacists to schedule their vaccinations. Okay, next slide. Now I would like to share with you one of the new expanded roles of pharmacists based on one of the questions asked. Will pharmacists in Malaysia be recognized as immunizers? So again, there is a need to have the standardized training. So most doctors and medical assistants that actually roll out that administer the vaccine, they are undergoing a standardized course. So we need to ensure that the course that we carry out with our pharmacists is also accredited. All right, next slide. So thank you. This is the next slide. So all our pharmacists are receiving messages like this. For example, this is the message from Wilayah Persekutuan stating that they will contact the pharmacists who have registered with the MPS list, and they are following up with the pharmacists that are recorded there, registered there. Okay, next slide. And this is what I want to just share with you as some of the positive happenings in the community pharmacy sector. Because of the information rolled out as just last week, that vaccination registration hasn't really surpassed a certain number that they expect. More can be done to advocate more and more people to register. And sometimes it's not about the MySejahtera app alone. It's about how to get to those vulnerable groups of patients, the patients who are in the rural setting who don't use IT, or the patients who are older. They're older and they don't feel comfortable with the MySejahtera app. So a lot of pharmacies, like I won't mention the chain, but some pharmacies have already begun to provide an essential service where they will help, because most of these pharmacies are located in neighborhood areas and your housing areas, so they have very good access. So a lot of children to elderly parents are helping their parents and getting them registered and going to see the pharmacist. Yeah, oh, the name is there anyway. So you can go and visit pharmacies to ensure the registration of your parents or your older family member is going to be carried out. Okay, so that's one of our community roles that we can play. Next slide. So we have posted this out as one of our materials, and please share with your other counterparts. Maybe they're not members of MPS, but please share. All of you can be our advocates to share with community pharmacies that hopefully their pharmacy can also help not only a community service responsibility, CSR, but more of a professional role to get people to register for the vaccination. Okay, and when we do these activities, it is seen very positively by the ministries. It is seen to be that we are collaborating well, and this is very good in our favor. Okay, next slide. So what I would like to share with you now is that the Malaysian Community Pharmacists, Malaysian Pharmacist Society has received information that Malaysia is trying to embark on a very good program called the Malaysia Vaccine Support Volunteers, and that is to hasten the National COVID-19 Vaccination Program, or PIC. So, you know, it is in good nature to reciprocate or to say thank you to the ministry for considering all the pharmacists also to be vaccinated. And we would like to come on board, just like the other healthcare or even the other volunteers, to volunteer our services for the third phase of PIC. For example, if you are a graduate and you're waiting for results, or you are just interested to know how does this public health program run, it's a massive public health program, then you could benefit by becoming a volunteer. There's a lot to be learned from doing such things, and you'll be placed in one of the centers. There's 605 centers. You'll be placed in one of them, and you will be collaborating with many other healthcare professionals. So we would strongly urge not only community pharmacists, but undergraduates and even academics to try to volunteer themselves for this endeavor. Okay, next slide. So as you can see, there's a lot of things we as pharmacists can try to get ourselves involved in, because this further solidifies our professional image among the public. As you know, the question asked just now is, will the public recognize us to administer? Well, I would always say that the public will always trust a healthcare provider that has high integrity and is giving them right information. So what I would say is, be ready for more expanded roles for pharmacists, provided we have the proper accreditation. And this is where we come in now, where the universities as well as the professional body is hoping to roll out very soon in April 2021 a program to certify vaccine advocates and vaccinators, primarily for the purpose of even what comes after COVID. It's not just COVID now, it's about the national immunization program. So hopefully we will have a new role to play, and I would like to share the next slide. Next one is this program on certified training program on immunization for pharmacists, which is a CTPIP. This is a collaboration of University Science Malaysia to conduct the credentialing. And this is available as an HRDF, if I'm not mistaken. HRDF is your training program. And some of the areas that will be covered in this accredited program, okay, a certified program, is for empowering pharmacists to deliver awareness as well as highlight vaccine administration. So MPS and MAP and USM hope to run this module this year in the aim of providing in-depth knowledge, skills, and resources for pharmacists to prepare them for immunization advocacy, immunization administration, and of course, surveillance. Surveillance meaning AEFI, pharmacovigilance, and so on. And this emphasizes on a healthcare team approach. It seeks to foster the implementation of interventions that will promote vaccine preventable disease prevention and educate the public on vaccine safety issues, which is our primary role. And the CTPIP consists of didactic theoretical online lectures, as well as experiential learning, face-to-face component in like OSCE style format and so on. And the didactic component has 8 learning modules with a total duration of around 40 hours, training on immunology, practice implementation, and regulatory issues. I dare not I'm not going to say that this is the latest copy, because there's something new that has come out, but you will be introduced to vaccines and the preventable diseases that need to be, that have introduced vaccination, the adverse events following immunization, special population vaccination, misconception on vaccines, policy implementation, communicating vaccines, and administration. So I would definitely encourage as many community pharmacists as well as pharmacists in general to undergo this training if they would like, and to sort of be prepared for what may come. Yeah. All right, next slide. So these are the next few events. Just to highlight, we're having our National Pharmacists Convention, the NPC. We're happy to have this online again, like last year. I think it will be handled in July, but we are having the Asian Association of Schools of Pharmacy event as well, online in 2022. And some good news that as early as 2022, we will be hosting, Malaysia will be hosting the Federation of Asian Pharmaceutical Association events. So I hope that when we have met today, a lot of you will be familiar with FIP, familiar with FAPA, familiar with MPS, so that a lot of learning can be benefited. Okay, next slide. So if you're not a member, but by virtue of being students, you're automatically members of MyPSA. So if you're not a member of Malaysian Pharmacy Society, I hope you will consider upon your FRP years to actually be joining us, because we really need your support to create a very unified pharmacy profession in the country. One of the beauties about pharmacy is that we splinter off into so many different branches. Some of us go to industrial pharmacy, some of us go to government pharmacy service, some of us go to community. So we splinter off, and suddenly everybody has a lot of, I would say, different interests. But if we do hold to the mantra that we are pharmacists first, we are pharmacists, and hopefully by being involved in the national body that governs us as a profession, which is besides the Lembaga Pharmacy, which is compulsory, but to consider Malaysian Pharmacy Society, so that maybe one day we can be like the Royal Pharmaceutical Society of Great Britain, that can be so unified. And so hopefully we can actually develop much more for the profession. Okay, and the next slide is to say thank you to all of you for being so attentive. I hope some of the questions we can actually continue now, so that you have gotten a bit more from the second session, and maybe we have more questions now. Thank you.
Thanks, Datin. That was very insightful. I would like to now open for question and answer. There is one in already. Who are the targeted group that we are looking at for vaccination by the community pharmacists, if ever that happens soon?
Oh, okay. Well, I guess at this moment now, there are a lot of things to weigh out. For example, the numbers of pharmacists that are already registered as vaccinators is still quite small. We have maybe about less than 30 in the country, but they are providing the necessary leadership and know-how into running the local program, right? But I think that essentially what we would like to see is the inclusion of community pharmacists in the national immunization program, which would not necessarily only limit us to COVID, but would be to those elderly groups of people, for example. If we follow the pattern, we follow the pattern of what happens overseas. There are two categories that are always highlighted in those sectors, in those countries, and that is the vulnerable groups as well as the marginalized groups. So sometimes when we in community practice, we have to do things differently from what the others are doing. So I would hope that we target most of the sector of population that is not being addressed. Yeah, that is my answer.
Yeah, I suppose it's sort of reaching out to those who probably can't get to us, isn't it?
Yes, correct. And we are very accessible. And in that way, I think we already have the infrastructure there. It is a bit too early to say, but we are trying to be diplomatically resolving the issue about what category vaccines fall under. But as you know, vaccines are category B under the legal schedule. So we are navigating this area also.
Sure. All right. A question come through. How many pharmacists have become the volunteers in the phase 3 of the as part of the 600 plus centers that will be opened?
All right. This call to ask for volunteers only went out about 2 days ago. I imagine that I don't have the data, okay, but I can imagine that it hasn't been enough. That's why the president of MPS has put out this call again through media, because one of the biggest questions that ministry always asks us whenever ministry puts out calls for volunteers is, how many are pharmacists, right? How many volunteers were pharmacists? And sometimes we have to say that we didn't know as much about it. We didn't go for that volunteering. So I hope that the result will be better this time, okay? I'll try to get the figure, but it's only been 1 or 2 days, so we won't know yet.
Sure. I mean, it's evolving so quickly. You know, when I first approached you for the title, in fact, it was still a question.
Yeah.
You know, will community pharmacies be prioritized? And
Yes.
now, you know, of course, congratulations to MPS. Yeah.
And I would like to thank a lot of there have been a lot of young pharmacists who have been very passionate to help this chapter, because a lot of work that goes into this chapter is teamwork. And we have to note the efforts of Ms. Harpreet, Mr. Teo, from Kedah, and Mr. Tanzi, very many young pharmacists. So, and also of course, our other pharmacists. But I just want to share with you that a lot is happening, and we depend on a lot of passion and interest from pharmacists all over the country to keep this momentum going. Yeah.
Okay, few more have come in, Datin, if that's okay.
Yeah, sure.
So one of the challenges with the vaccines is I suppose the entire cold chain management. So with logistics and storage, how ready are we, and how are we prepping up, and what sort of challenges are we facing, or would we be facing?
Yeah, well, I think the best decision that the ministry and Ministry of Health and MOSTI made was to ensure that vaccination centers are well placed, and because these vaccination centers are going to be the sort of lifeline areas, and that's where all the issues about storage and about ensuring the generators are there, ensuring electricity supply, all this is being done at a very good level. As you know, the general practitioners have been asked also to help with the rollout of vaccination, right? So therefore, I hope we as pharmacists have a role to play there, because we can actually advise general practitioners also about cold chain management, and sometimes it requires maybe I remember in the past that some of the clinics, when they start up, they will call pharmacists to advise them how to run a dispensary. So I think sometimes we must work very closely with doctors. Okay, as far as storage goes, more vaccines now. I mean, after the first phase, we may find that other vaccines are going to be easier in terms of storage. So
sure, with temperature and so on, isn't it?
So I think that we have to update ourselves with what vaccine is going out in which phase, and that's why I showed the first slide, because some are temperature sensitive, some are not. So it is just that knowledge that we have to be ready with.
In your slide, Datin, 11% of community pharmacists were found to be hesitant to take the COVID-19 vaccine. Can you shed some light as to what we can do? Is this, I suppose you want to touch a little bit also on the anti-vaxxers?
Oh, okay. Actually, I would like to say that the 89% result is fantastic, because in another similar study that was carried out in the pre-planning of the COVID vaccination among some of the public personnel, the government personnel, it was as high as 30% were a bit hesitant. 30%. So 11%, 30%. That one was done over 300 people. But sometimes we have to be very, very empathetic. Maybe these are the pharmacists who are planning pregnancy. Maybe these are the pharmacists who are pregnant. Yeah. So I mean, there will always be a certain demographic that will not feel that they need to be vaccinated. It could be a personal choice. Yeah, it could be a choice. But so what we have to say here is that the entire vaccination process, vaccination program is voluntary. It is a voluntary program. But I am a firm believer that when somebody does something voluntarily, they know what they're doing because they're armed with the right information and the education, then they will be happy with their choice. So I wouldn't worry too much about the certain small percentage that don't get vaccinated, but we do have to be cognizant of the anti-vaxxers out there because the information that they spread can be quite damaging. Therefore, as pharmacists, I implore you to not reshare information that is not vetted, information that has maybe a questionable basis, so you can assist in that way to arm yourself with the myth, you know. I think most of the young generation know that they can go to the site to check whether the information is sahih or not, you know, valid information. Okay.
Yeah, so yeah, just touching a little on evidence base, isn't it? Share what is supported by evidence. Okay, one question. What are the numbers we have presented to the MOSTI or to the government to show the readiness of community pharmacists to be future immunizers? Do we have numbers to convince the role?
Okay. At the moment now, it has taken about a good 3 months to produce the module. Okay. I mean, the module had started earlier also, but I think what is important is that we try to get as many pharmacists on board with the certified module. And then with the numbers, even when we shared that day, that we have about 30 recognized vaccinators in the country, even that they found to be quite encouraging because it's not so much about because that signifies that this has actually happened in other countries. So that was one of the encouraging things. Okay, but I think that the numbers that we need are obviously dependent on what is the primary aim of the role of pharmacists in the government sector as well, because as we know, the government sector pharmacists have certain roles to play in their sector as well, but the numbers are larger. Just to share with you, the current distribution of pharmacists in public to private, there's about 70 to 30%. 70% are in the government, 30% are in the private. So when we talk about numbers, it is important that we look at the numbers based on what role they want to carry out. Yeah.
Yeah, understood, agreed. Yeah. Okay, so if there are no more questions, are there any more questions from participants? Last call. Okay, if there are none, please join me in thanking Datin Mariani for her work, hard work, in guiding community pharmacists and the pharmacy profession as a whole. And with that, on behalf of the faculty, thank you for your time. And we hope to see you soon.